Good afternoon in our respectable principal ma'am and our other teachers and my beautiful classmate. This is Sweetie Bishas, student of Shyamoli Nursing College, Diploma in Nursing Science and Midwifery, third year session 2021 to 2022. I am the leader of the group B Rose. Let's introduce my team members: Tithi Roy, Roxana, Prosenjit Shaha, Tumpa Bala, Shumi and Shyamoli. Thank you all for joining us today. Our presentation topic is assessment of knowledge and prevalence of needlestick injury among nursing students at all selected nursing college in Dhaka city. Introduction. Needlestick injury is a serious occupational hazard. Needlestick injury poses significant risks to healthcare workers in their daily practice. Students are more vulnerable due to lack of experience and skill development. Nursing students face heightened risks during clinical placements. Serious disease transmission risks. Exposure may be transmit HBV, HCV, HIV through needlestick injuries. Study purpose. The study assesses knowledge and prevalence of needlestick injury among nursing students. Background of the study. Global context. World Health Organization reports millions of healthcare workers experience needlestick injury every year, making it a widespread occupational concern. Nursing students activity. Nursing students handle injection, cannulation, ampoule breaking frequently during their clinical training. Risk factor. Lack of awareness, improper practice and workload increase the risks of needlestick injury among students. Research gap. Data in Bangladesh private nursing college is limited, necessitating focused research in this context. Next, I will invite Tithi to discuss about her part.
Thank you, Sweetie. Now I will continue the presentation. My topic is research problem statement and research objective. Research problem statement. Underreporting issue. Needlestick remains common but often underreported in healthcare setting. Knowledge gaps. Insufficient awareness regarding post-exposure first aid procedures among students. Unsafe practice. Many students still recap needles, which is prohibited by safety guidelines. Vaccination concern. Vaccination status against hepatitis B is suboptimal among nursing students. A structured study in this context was necessary to address these critical gaps. Research objectives. General objectives. Assess knowledge and prevalence of needlestick remains among nursing students. Specific objectives. Identify socio-demographic characteristics of the study population. Determine needlestick injury prevalence among nursing students. Assess knowledge on risk factor and disease transmission. Identify activities leading to injury during clinical practice. Examine post-exposure practice and protocol followed by student. Now I will invite to continue the presentation Roxana.
Thank you, Tithi Roy, for giving me a chance. Now I will discuss about my topic. Research questions. Knowledge assessment. What is the level of knowledge of nursing student about needlestick injury? Causative factors. What are the most common causes and circumstances of injury? Prevalence data. How many students experienced needlestick injury during clinical posting? Response practices. What post-exposure steps do students take? Methodology. Study design. Descriptive cross-sectional. Study setting. Shyamoli Nursing College, Dhaka. Study period. April to September 2025. Study population. Diploma nursing student with minimum 3 months clinical exposure. Sample size and technique. 100 students selected through purposive sampling methodology. Data collection process. Instrument used. Semi-structured questionnaire with 3 sections. Demographics, knowledge, practice and prevalence. Questionnaire development. Pre-tested with 5 students to ensure clarity and relevance. Questions types. Consisted of both closed and semi-open questions for comprehensive data collection. Data collection method. Data collected through face-to-face and self-administered method to maximize response rates. Our team member Prosenjit Saha now will be discuss about our next presentation topic.
Thank you, Roxana, for the breathtaking speech. Hi everyone, I am Prosenjit Shah. I am talking about my topic's content are socio-demographic profile, knowledge of NSI, prevalence of needle-stick injury, socio-demographic profile, age distribution, majority 21 to 23%, for 45%, gender distribution 90% female, 10% male, experience level less than 6 months of for 30%, 6 months to 1 year 35%, more than 1 year 35%, vaccination status fully vaccinated 45%, partially vaccinated 30%, non-vaccinated 25%. Knowledge of needle-stick injury. Needle-stick injury needle-stick injury means when a needle accidentally pokes or cut the skin. 95% correctly defined needle-stick injury. Transmitted disease. 85% identified hepatitis B vaccination, hepatitis C vaccination, human immunovirus as transmitted disease. Recapping prohibition. Only 60% new recapping is prohibited. Correct first aid. 55% new correct first aid. Washing with soap and water. Incorrect beliefs. 30% incorrectly believes squeezing the wound is appropriately. Prevalence of needle-stick injury. 35% of students experience at least one needle-stick injury. Reinforce that needle-stick injury is a common risk during training. Recapping was identified as the most common causes. Next, I will invite my team member discuss the next topics.
Namaskar. Thank you, our team member Prosenjit Saha. I am Tumpa Bala for give me a chance. Now I will discuss about my topics. My topics: activities leading injury and reporting behaviors. Injected admin, recapping needles, breaking ampoules, and waste disposal. Reporting behavior. Only 28.6% reported injuries, 71.4% did not report. Reason for not reporting: fear of scoring or poor grades, 60%, though the injury was minor, 32%, did not know whom to report, 8%. Thank you. Please welcome on the stage Shumi, and next topics explain it.
Thank you, Tumpabala. Assalamu alaikum. Good afternoon. I now will discuss about my topic. Discussion key finding. Needle-stick injury prevalence. Needle-stick injury 35% similar to regional studies. Unsafe practice. Recapping remain common. Knowledge practice gap. Significant gap between theoretical knowledge and clinical practice. Underreporting culture. Underreporting culture increase long-term health risks. Inadequate vaccination. Inadequate vaccination puts students at risk, further risks. Conclusion. Significant hazard. Needle-stick injury is a significant hazard for nursing students. Widespread underreporting. Underreporting is widespread. Knowledge-based practice. Knowledge high but practical safety behavior poor. Insufficient vaccination. Insufficient vaccination coverage insufficient. Next, I will invite Shyamoli to discuss about her part.
Thank you, Shumi. Hi everyone. Assalamu alaikum. I am Shyamoli. Now I will discuss about my topic. Recommendation enhancing safety. Mandatory vaccination. Mandatory hepatitis B vaccination before clinical posting. Safety box availability. Ensure availability of safety box in all practice area. Blame-free reporting. Introduce blame-free reporting system. Skill-based training. Conduct regular skill-based training on safe injection and first aid. Educator monitoring. Strengthen monitoring by educator during clinical session. A safer future for nursing student. By implementing this recommendation, we can significantly reduce the risk of needle-stick injury and foster a safer learning environment for our future healthcare professional. Thank you. Now I would like to invite our group leader, Suti Vishwas, to continue the presentation.
Thank you everyone for your kind attention and patience. Now we are open any question or comments you may have.
আচ্ছা, তোমাদের রিসার্চে আমি একটা রেজাল্ট দেখলাম যে রিক্যাপিং মানে নিউরোলজিক ইনজুরি হওয়ার একটা মোস্ট কমন কারণ হলো রিক্যাপিং। রিক্যাপিংটা বলতে তোমরা কি বুঝো?
নিডেল থেকে যে ক্যাপটা খোলা হয় ওটা আবার লাগানোর পরে যে ইনফেকশনটা বা চান্সটা হতে পারে ওইটাই বলি।
মানে আবার ক্যাপটা লাগানোর সময় যে
হ্যাঁ,
ইনজুরিটা
ইনজুরিটা
হয়
হতে পারে
সেটাকে বলা
recapping।
recapping।